Fatuma Kinsey Abbas. I'm the Executive Director of Pastoralist Girls Initiative, a local NGO based in Garissa. We are having several programs that are going on, one of them being diabetes among children in Garissa County, and that's the one we are implementing with Safaricom Foundation. What has made me go to being one of the founders of Pastoralist Girls Initiative is that there has been a gap to address issues of girls, because I am a teacher by profession, and when I go to school, I interact with children most of the time, and you hear one case to the other. And then that's the time now we have realized that there's a diabetics among children that nobody is sensitizing within our community. Then the ignorance of the community, because you will see someone's child has diabetes, but at the end of the day, they don't want to take to the hospital. There are 2 million Kenyans affected with diabetes, but the children who are under 15 who are affected with diabetes in Kenya is 497,000. Some of the key symptoms that one can look at are, one, the weakness in the body. Then the other symptom you can look at it is that if there is a chronic wound that is not healing. Then if you see a child most of the time urinating, a lot times urinating, or taking a lot of fluids in terms of getting thirsty very easily. It's a chronic cold that normally needs to get insulin and therapy for the children. And that is where now the Safaricom Foundation, through our partnership, is coming in to support the children with insulin, to support them with awareness, and also to train them on how they can manage their diabetes. We are working in a way that we ensure that we closely work with the Department of Health to ensure that the health workers are trained. We are working at renovating, I think, four facilities, and building a new diabetes center at the referral hospital. We are looking at working with children and training the children to become champions for raising awareness among themselves in terms of the diabetes. The reason is because we know the characteristics of the regions we come from very well. The reality is that you will see the distance are like 7 to 8 kilometers from one healthcare center to the Manyata, or more than that. They believe in giving camel milk because they believe camel milk will reduce the blood sugars or the levels of the diabetes in the child. The first important impact we're seeing is that we have distributed the medicine to the centers through the Department of Health, through the pharmacist, the chief pharmacist, and that one is now reaching every child where they are. We have recruited 100 community health workers and trained them. We have trained 60 health care workers. Now these 60 healthcare workers come from every sub-county we are working with. We're looking at cascading that so that they also reach more healthcare workers and also reach more community members as the CHVs. They can now go and identify the children and bring that, and that's why the data is now doubling and tripling. Go out and get screened for diabetes. That is the message I'm going to send, so that if you'll be on medicine, you can get your medicine at an early stage than when it is too late.